happy to introduce to you Dr. Stephen Reichbach. He's a graduate of the State University of New York at Syracuse Medical School. He trained at the State University of New York at Stony Brook in anesthesiology with a specialty training in pain management and pediatrics during his residency. Dr. Reichbach has been board certified in anesthesiology since 1994. He practiced in New York from 97 to 2015 as a partner with the North American Partners in Anesthesiology, the largest private practice anesthesiology group in the United States. In 2015, Dr. Reichbach moved to Sarasota and served at the Ambulatory Surgery Center, providing anesthesia for patients undergoing various nerve block procedures. The doctor has worked with ketamine for more than 2 decades in general anesthesiology. This is a chemical that's used to take good care of the patients, and he became an advocate of intravenous ketamine infusions after observing the relief patients experience with treatments and reviewing the growing body of research over the past decade supporting its efficiency. These ongoing studies and successful results have inspired Dr. Reichbach to utilize ketamine as a viable and effective treatment for severe depression and neuropathic pain disorders. So the mission of his Gulf Coast Ketamine Center is to seek out solutions for his patients' pain. That's his primary goal, is to kill the pain for his patients, and that has now led him to this medical cannabis as an opportunity. So he's going to share with us the process for diagnosis, obtaining a card, and hopefully tailoring a little bit of that medical cannabis to the individual needs. Ladies and gentlemen, please join me in welcoming Dr. Stephen Reichbach.
I'd like to thank everybody for coming. My name is Dr. Stephen Reichbach. That was quite an introduction, and I don't think I could have done it any better by myself. I'm going to continue on the theme of the day, cannabis, and I'm going to focus on how patients who have decided they want to look into this or pursue it, how they will be able to obtain a cannabis card here in Florida. Just a little bit of background once again. I am an anesthesiologist. I was practicing in New York for over 25 years as part of a large anesthesiology group. Became extremely interested in IV ketamine infusions when I moved down here, and was looking for something. The one thing that I learned over my 21 years of practice is that there were a whole lot of patients out there that were suffering and struggling with certain types of conditions where conventional modes of therapy were not helping. And whether it was chronic pain syndromes or mental health issues where conventional medications and therapy weren't helping, they needed an alternative. And I felt that ketamine was something that I could offer to them in respect to that. With that in mind, I opened the Gulf Coast Ketamine Center in 2016 when we moved down here. And soon after that, probably about a year or so after that, when Amendment 2 passed here in Florida, sort of as a natural extension, I decided I wanted to offer the cannabis assessments to patients that qualified here in Florida. Again, the theme being offering something to patients that was different. It was something that I thought, after doing my own homework, would be extremely beneficial for certain patients. And probably more important than helping with pain, helping with anxiety, helping with sleep, was trying to get patients off more highly addictive drugs and medications that they've been on for long periods of time that either weren't helping or were very, very difficult to come off of for withdrawal issues. And so that's kind of how this whole thing blossomed for me. So how do you get a card here in Florida? If you're a patient who is struggling with a condition or something it's affecting your daily life, your ability to function, your interactions, well, here are the rules. You need to be either a state resident of Florida or a seasonal resident. And there are different criteria for each. For someone who is a state resident, you need to be 18 years or older. You must have a documented qualifying condition supported by medical records. If you're under 18 years old, you must have a caregiver, and I'll get more into that in a minute. The fee for the card that the state charges is $77.75. You need proof of residency, which is a valid driver's license or a state ID card that shows your current address. For patients who are interested, who are seasonal residents, you need to be 18 years old. You must have documented qualifying condition supported by medical records. You have to have a passport photo, again the fee for $77.75, and 2 proofs of residency. Those can be, but not limited to, bank statements, tax bills, lease agreements, gas, electric bills, etc. And you must reside in the state of Florida for 31 consecutive days. Patients under the age of 18 must, they are able to get a card, but there are some caveats. They must have a, they must be Florida resident. Again, the $77 fee, and they must have a caregiver, usually a family member, to act on their behalf as far as that goes. For older patients, and we have a number of older patients, infirmed adults, again, they must be 21 years of age, Florida resident, and the caregiver must have a copy of a court authorization to act as a legal guardian, and a copy of their health care surrogacy or power of attorney. What conditions would qualify you for a medical cannabis card? And there are a number of them. Cancer. If you've ever been diagnosed with cancer, that would qualify you for a cannabis card. Crohn's disease, glaucoma, HIV/AIDS, multiple sclerosis, epilepsy, PTSD, ALS, also known as Lou Gehrig's disease, Parkinson's disease, a chronic non-malignant pain syndrome arising from any one of the above conditions, any terminal condition with less than a 1-year survival, and here's the one that's probably the most important for at least the patients that we see, any condition of similar type or class of condition mentioned above. So, we will get calls from patients with severe rheumatoid arthritis and pain, patients with anxiety, patients who can't sleep at night, any type of pain syndrome. And in all likelihood, you would be able to qualify with those conditions, even though they are not the specific conditions mentioned above. A simple phone call to our office would clarify that if you have any questions or you know of anybody that would be interested in that. Some of the other conditions that I mentioned that would fit into that criteria: anxiety, depression, insomnia, arthritic pain, chronic post-surgical pain, IBS, OCD, migraines, Ehlers-Danlos syndrome, autoimmune diseases, rheumatoid arthritis, lupus, neuropathies, and a host of others. So, what comes next? Well, once a patient is qualified, has been deemed qualified to obtain a medical cannabis card, a recommendation is placed by the qualifying physician into the state database. After the application has been approved by the state, patients are directed to a dispensary to purchase their cannabis products. There are many different dispensary companies throughout the state operating dispensaries and offering delivery services. What we've found is that cannabis is completely different than most of the medications that we've been used to using and we've been prescribed in the past. So this is not something where you get strep throat and you go to your primary and he says take amoxicillin for 10 days, 3 times a day, and problem solved. With cannabis, it seems everybody responds differently to the different products, to the different routes of administration, and there is a trial and error period with this. And Certain patients respond one way to a specific product, and other patients will respond 180 degrees difference. There are some generalities with the products. You know, most people are aware that sativas are stimulating and uplifting and, you know, give you energy. And indicas are great for total body high and help you get to sleep and good with pain. But it's not like that necessarily for everyone. So what we try to convey to our patients is, yeah, we're going to start this, and we're going to start at a low dose and take it slow and increase it as needed and change things as needed. But patients need to be aware, and they need to be guided. Many of them are older patients. The average age of the patients in our practice is about 61. So those are the patients that we're focusing on. And you know, as long as there's feedback and we keep in touch and they don't get frustrated and just stop using it and give up, the response can be profound. And we've gotten patients off of narcotics, we've gotten patients off of benzodiazepines, all kinds of sleep remedies, which is not easy to do. And it's been a game changer in our practice. And to say it's an eye-opener, and I never expected it to be as significant as it's been, is really saying something. We've had patients with stage 4 cancer when we first started this 2 years ago, who were given about 3 months to live, and every 3 months when they come back for their follow-up visit, I look at Lolita, the head nurse here, and I say, do you think they're coming back for their follow-up? And they come back, and they look better than they did the 2 years before. And my mind is blown. And their biggest concern at that point is, where they couldn't even get out of the house before, is, I'm going on a cruise with my family. How do I get this stuff on the boat legally? And the answer is, I can't tell you that. You're not supposed to take it anywhere outside the state of Florida. They said, but I can't live without it. And I have to go on this cruise. And that's really the most frustrating thing of this whole thing. And hopefully things are moving in a different direction, in a better direction. And I think that's pretty much it. Those are some resources, good resources to get information about specific products and just research that's been done. The other frustrating thing, obviously, that we're up against here is federally, as I'm sure you've heard earlier in the day, cannabis is still considered a Schedule I drug, which means it has no medical value whatsoever and is extremely addictive, more addictive than heroin and Dilaudid and fentanyl. You know, my opinion would differ, obviously, on that, but that's where it stands now. And what that does is it makes it extremely difficult to get funding for research and come up with, you know, more hard data and facts and run, you know, large-scale studies the way that they should be run. So most of the information that we're getting at this point is coming from other countries and, you know, countries that have been a little bit more progressive, you know, over the last decade with researching this. But I think the tide is changing and people are looking for alternatives, and we're finding that this is a game changer for a lot of patients.